So it's my honor and distinct privilege to represent the Planning Institute of Jamaica, the PIOJ, at the launch of the State of the World Population Report 2018. The PIOJ, on behalf of the government and people of Jamaica, welcomes the continued close collaboration and support from the United Nations Population Fund, UNFPA, and other development partners in the formulation, implementation, monitoring, and evaluation of Jamaica's Population and Development Program. The theme of the State of the World Population Report focuses on the power of choice, particularly of women to choose the number, timing, and spacing of their children, and has been at the center of the programs, projects, and activities undertaken by the government with the support of our development partners. In this regard, we have been able to strengthen our national population program, particularly in the areas of sexual and reproductive health and reproductive rights. These initiatives, in addition to the improvements in our education system and the increase in female employment levels, have contributed significantly to the reduction of fertility in all reproductive age groups, that's 15 to 49 years, moving from an average of 3 children per woman in 1994 to around 2.4 children per woman in 2008, as reflected in the Reproductive Health Survey. However, of special significance is the reduction in the number of births among adolescents, the 15 to 19 years of age. In the adolescent age group, the number of births fell from 115 per 1,000 women of the same age group in 1994 to 72 births per 1,000 women in 2008. The decline in the adolescent fertility rate was strongly influenced by the number of programs supported by the UNFPA and other international development partners targeting adolescents over this period. Despite this success, however, the adolescent fertility rate is still considered to be too high. To stymie this rate, the government of Jamaica, through the Ministry of Education, unveiled in 2013 the policy on reintegration of teenage mothers in the formal education system. This policy was created to ensure that all teenage mothers are able to return to the formal education system and are encouraged to pursue their academic goals and break the intergenerational transmission of poverty. As a support to facilitating safe pregnancies and safe births, since 2014, the government of Jamaica has been implementing the program for the reduction of maternal and child mortality, PROMAC, through the Ministry of Health. The program was designed to reduce deaths attributable to the high-risk factors for mother and child through the establishment of high-dependency units in select healthcare facilities with specialized equipment for newborn and pregnant women. The theme of this year's report, the power of choice, reproductive rights, and the demographic transition, mirrors the fundamental link between fertility decision-making and the changes in the growth, size, structure, and distribution of populations. Jamaica's population is currently at the final stage of the demographic transition, meaning that both the birth and death rates are low and are contributing to the low population growth rate. This would not have been achieved without the advocacy programs of the government and non-government organizations of the past in promoting the conditions and providing the means for women to make effective choices relating to their reproduction. Let me add that the fertility target in our current and former population policies has been largely achieved. However, as a matter of caution, if the fertility rate falls below the level that each woman would not be able to replace herself, or each couple would not be able to replace themselves in the next generation, then the consequence would result in a naturally declining population over time. The effect of a naturally declining population would be compounded by a situation of net outward migration. Both effects would result in a faster declining population than is the case observed among all developed countries in the past and at present. The challenge, therefore, as we move into the future, is to ensure that we reconfigure our national population and international migration policies so that we accommodate the power of choice, while at the same time meet the target as exemplified in the Population Sector Plan on the Vision 2030, which aims to create a population which meets the sustainable development needs of the country.